Hello everybody, we are in the University of Lagwat, in the Faculty of Social Sciences, in the Department of Psychology, Education Sciences, and Speech and Language Therapy. Today, in the program of remotely lessons in the Speech Language Therapy, we will talk about hearing impairments and deafness. The auditory systems is a body systems that is responsible for the sense of hearing. It's divided into two subsystems. The first is peripheral system, auditory system. It's counted outer ear, middle ear, and inner ear. The second is the central auditory systems from the cochlear to the primary auditory cortex. In the definition of hearing impairment, it is a decrease or absence of hearing, and it is a common disability due to injury to one of the components of the auditory systems. Which is a partial or complete loss of the sense of hearing that affects one or both ears. The deaf is the one who has a hearing impairment and doesn't allow him to learn his mother tongue and participate in the normal activities required by his age, and prevents him from counting his normal education. Types of now we have to talk about types of deafness according to the location of the injury. We have the perception deafness. It signals a deterioration of the auditory pathway from the cochlear to the auditory cortex of the brain. The second is conductive deafness. It happens when sounds cannot get through the outer and middle ear. It may be hard to hear soft sounds. Louder sounds may be afflicted. Medicine of surgery can often fix this type of hearing loss. The third is mixed deafness. Mixed deafness loss has elements of both conductive hearing and perception deafness. In the second classification, types of deafness according to the age of the ear injury, we have two types. The first is congenital deafness. The second is acquired deafness. Also, we have the third classification, types of deafness according to the degree of hearing loss. We have three types. The first is mild hearing impairment. The second is medium hearing impairment. The third is severe hearing impairment. Now we will talk about electronic or technology intervention in hearing impairments. It is electronic surgical intervention. A cochlear implant is a small and complex electronic device that can help to provide a sense of sound to a person who is profoundly deaf or severely hard of hearing. The implant consists of an external portion that sits behind the ear, and the second portion that is surgically placed under the skin. An implant has the following parts. The first is a microphone which pick up sounds from the environment. The second is speech processes which selects and arranges sounds picked up by the microphone. The third is transmitter and receiver stimulator which receive signals from the speech processor and convert them into the electric impulses. The fourth is an electrode array, which is a group of electrodes that collects the impulses from the stimulator and sends them to different regions of the auditory nerves. The implantation doesn't restore normal hearing. Instead, it can give a deaf person a useful representation of sounds in the environment and help him or her to understand speech. This subject is very important about speech language therapists and pathologists because it's in impairment it's very common. Also they have education and rehabilitation is very important for them. Also it can give us an access for education. Thanks for your attention.